Today, we're peeling back the layers on a topic that affects more people than you might think, and we're about to reveal some surprising allies in the fight for kidney health. But before we dive into these nature's kidney guardians, let's pause for a moment. Have you ever wondered why some people seem to sail through life with perfect health, while others struggle with recurring kidney issues? The answer might be simpler and more delicious than you ever imagined. Stay with us as we explore the hidden world of kidney health and uncover the top 3 fruits that detoxed millions of kidneys and prevented dialysis. By the end of this journey, you'll have the knowledge to potentially save yourself or a loved one from the grip of kidney disease. Are you ready to discover nature's secret weapons against kidney trouble? As we step into 2024, a health crisis is unfolding right under our noses. Kidney disease, once considered a rare condition, has now become a common household term. From New York to New Delhi, the story is the same. More and more people are grappling with kidney-related issues, and the numbers are nothing short of alarming. Chronic kidney disease, CKD, and kidney failure have seen a significant rise in recent years. This surge isn't just a statistic, it represents millions of lives changed, families struggling, and healthcare systems stretched to their limits. The increase in dialysis treatments, a procedure that artificially removes waste from the blood, is a stark indicator of this growing problem. But what's driving this kidney health crisis? The culprits are familiar foes: poor diets laden with processed foods, sedentary lifestyles that have become all too common in our digital age, and the rising tide of conditions like diabetes and hypertension. These factors have created a perfect storm, placing our kidneys under siege. The impact of this crisis extends far beyond individual health. It's placing an enormous burden on healthcare systems worldwide. Hospitals are seeing an influx of patients with kidney issues, and the cost of treatments like dialysis is skyrocketing. This isn't just a health crisis, it's an economic one too. However, there's a growing interest in exploring natural remedies to support kidney function and prevent severe conditions like CKD. This shift towards natural solutions isn't just a trend, it's a response to the urgent need for accessible, effective ways to maintain kidney health. And this is where our story takes an exciting turn. Among these natural remedies, certain detoxifying kidneys and enhancing their overall health. These aren't exotic, hard-to-find fruits. In fact, you might already have them in your kitchen. These kidney-friendly fruits are packed with essential vitamins, antioxidants, and natural compounds that support kidney function. They work by flushing out toxins, reducing inflammation, and improving urinary tract health. In essence, they act as nature's own kidney cleanse agents. But here's the most exciting part. By including these fruits into your diet, you could be taking a proactive step towards maintaining healthy kidneys. You might even reduce your risk of needing dialysis in the future. It's a simple change that could have profound effects on your health. As we go through, we'll explore the top 3 fruits renowned for their exceptional kidney detoxing properties. These aren't just random picks, they've been celebrated for their powerful health benefits, particularly in supporting kidney health. Each of these fruits comes with strong scientific backing and a wealth of anecdotal evidence that underscores their effectiveness. Researchers have conducted numerous studies demonstrating their positive impact on kidney health, from reducing the risk of kidney stones to improving urinary tract health and aiding in the removal of toxins. But it's not just scientists who are singing praises of these fruits. Countless individuals have shared their personal experiences and success stories, attributing their improved kidney health to the regular consumption of these nature's kidney guardians. So, let's dive in and uncover the secrets of nature's kidney protectors. But first, let's take a closer look at why our kidneys are so crucial and what makes them vulnerable to damage. In this analogy, your kidneys are the waste management system, the water treatment plant, and the quality control department all rolled into one. They filter a staggering 120 to 150 quarts of blood each day, removing waste and excess fluids, which are then excreted as urine. But that's not all. Your kidneys are multitaskers extraordinaire. They regulate the body's balance of electrolytes, ensuring that crucial elements like sodium, potassium, and calcium are at just the right levels. They're also key players in maintaining proper blood pressure and ensuring the stability of our internal environment by managing the body's acid-base balance. However, like any hard-working system, our kidneys can fall victim to wear and tear, especially when faced with certain health challenges. Chronic conditions such as diabetes and hypertension are leading causes of kidney damage. In diabetes, high blood sugar levels can damage the tiny blood vessels in the kidneys, impairing their ability to filter waste properly. Hypertension, or high blood pressure, can cause the arteries around the kidneys to narrow, weaken, or harden, reducing blood flow and leading to kidney damage over time. Other factors that can throw a wrench in the works include urinary tract infections, kidney stones, and prolonged use of certain medications that can be toxic to the kidneys. Even lifestyle choices can impact kidney health. A diet high in processed foods, lack of physical activity, and smoking can all contribute to the deterioration of kidney function. Early kidney disease symptoms can be subtle and easy to miss. That's why it's crucial to be aware of the signs of kidney disease. These can include changes in urination patterns, fatigue, swelling in the legs, ankles, or feet, and persistent itching. But here's the good news: armed with the right knowledge and tools, we can take proactive steps to protect and maintain our kidney function. This is where our fruity kidney guardians come into play. Let's dive in and explore the first fruit on our list, a small berry with a big impact on kidney health. 1. Cranberries, the tiny titans of kidney health. When you think of cranberries, you might picture Thanksgiving dinner or a refreshing glass of juice. But these small, tart berries pack a powerful punch when it comes to kidney health. In fact, they're one of nature's most potent weapons against urinary tract infections, UTIs, and kidney stones. Cranberries are nutritional powerhouses. They're rich in vitamin C, E, and K, as well as dietary fiber and a range of antioxidants. But what makes them truly special for kidney health are two key compounds, promethocyanidins and canic acid. Promethocyanidins are powerful antioxidants that help prevent bacterial adhesion in the urinary tract. In simpler terms, they make it harder for harmful bacteria to stick to the walls of your urinary tract and kidneys. This is crucial because it significantly reduces the risk of urinary tract infections, which, if left untreated, can escalate into more serious kidney problems. Canic acid, on the other hand, helps prevent the formation of kidney stones. It works by making the urine more acidic, which inhibits the formation of calcium oxalate stones, the most common type of kidney stones. But the benefits of cranberries don't stop there. Their antioxidant properties help neutralize free radicals and reduce inflammation, supporting the kidneys in their natural detoxification processes. This means that cranberries not only help prevent kidney issues, but also support overall kidney function. Scientific evidence strongly backs the benefits of cranberries for kidney health. Numerous studies have demonstrated their effectiveness in promoting urinary tract health and preventing infections. For instance, A study published in the American Journal of Clinical Nutrition found that regular consumption of cranberry products significantly reduced the incidence of UTIs in women. Another study, published in the Journal of Urology, highlighted that cranberry juice consumption decreased the likelihood of recurrent urinary tract infections. These findings underscore the role of cranberries as a natural aid in maintaining kidney health and preventing related issues. So, how can you incorporate more cranberries into your diet? 1. Fresh or dried cranberries can be added to salads for a tart burst of flavor. 2. Blend them into smoothies or juices for a kidney-friendly drink. 3. Opt for unsweetened cranberry juice to avoid excess sugar intake. 4. Include them in baked goods like muffins or scones for a healthy twist. Next, we'll explore a summer favorite that's not only refreshing but also a kidney's best friend. 2. Watermelon, the hydrating hero for kidney health. Picture a hot summer day, the sun beating down, and the cool, refreshing taste of watermelon on your tongue. It's not just delicious, it turns out that this juicy fruit is a superstar when it comes to kidney health. Watermelon is nature's own hydration station. It's composed of about 90% water, making it an excellent choice for keeping your body, and your kidneys, well hydrated. But there's more to this fruit than just water. Watermelon is packed with vitamins A, C, and B6, as well as antioxidants like lycopene and citrulline, an important amino acid. So, how does watermelon work its magic on your kidneys? Let's break it down. 1. Hydration hero. The high water content in watermelon helps keep your body hydrated, which is crucial for kidney function. Well-hydrated kidneys can more efficiently flush out toxins and waste products. 2. Natural diuretic. Watermelon has natural diuretic properties, which means it promotes increased urine production. This helps your body get rid of excess fluids and waste more effectively. 3. Antioxidant armor. The lycopene in watermelon is a powerful antioxidant that protects kidney cells from oxidative stress and damage. This is particularly important because oxidative stress can lead to chronic kidney disease and other health issues. 4. Blood pressure buddy, citrulline, the amino acid found in watermelon, helps to relax blood vessels and improve circulation. This can enhance kidney function and reduce the risk of high blood pressure, a common cause of kidney damage. Scientific research backs up these kidney-friendly benefits of watermelon. Studies have shown that the high water content and diuretic properties of watermelon can help in reducing the concentration of harmful substances in the kidneys, promoting overall kidney health. For instance, research published in the Journal of Food and Nutrition Research highlighted that watermelon consumption improves hydration status and supports renal function. Experts often recommend watermelon as a natural remedy to aid in the prevention of kidney stones and support overall urinary tract health. Its ability to increase urine volume and reduce urine acidity can help prevent the formation of certain types of kidney stones. Now, you might be wondering how to incorporate more watermelon into your diet. Here are some delicious ideas. 1. Fresh slices. Enjoy watermelon as fresh slices for a quick and easy snack. 2. Smoothies. Blend watermelon with other fruits like strawberries or mint for a refreshing smoothie. 3. Salads. Add watermelon cubes to salads for a sweet and juicy twist. There's one more powerful ally in the fight for kidney health, and it might surprise you. Are you ready to discover the zesty defender of kidney function? 3. Lemons. The zesty defenders of kidney health. When life gives you lemons, your kidneys rejoice. These bright yellow citrus fruits, Known for their tart flavor and high vitamin C content, are unexpected heroes in the realm of kidney health. Each lemon is a powerhouse of nutrition, packed with an impressive amount of vitamin C, an essential nutrient that supports the immune system, aids in collagen production, and acts as a powerful antioxidant. But what really makes lemons shine in terms of kidney health is their high content of citric acid. So, how do lemons work their magic on your kidneys? Let's squeeze out the details. 1. Stone stoppers. The citric acid in lemons increases the levels of citrate in urine. This is crucial because citrate binds to calcium, a common component of kidney stones, preventing it from crystallizing and forming stones. This natural process helps to reduce the risk of developing kidney stones and supports overall kidney health. 2. Detox dynamos. The detoxifying properties of lemons help maintain kidney function by promoting hydration and enhancing the kidney's ability to flush out toxins and waste products. The simple act of drinking lemon water can stimulate urine production, helping your body to eliminate waste more efficiently. 3. pH balances. While lemons taste acidic, they actually have an alkalizing effect on the body once metabolized. This can help balance the body's pH levels, reducing the strain on your kidneys to maintain this balance. 4. Antioxidant arsenal. The high vitamin C content in lemons acts as a powerful antioxidant, protecting kidney cells from damage caused by free radicals. This protection is crucial for maintaining long-term kidney health. Scientific evidence strongly supports the benefits of lemons for kidney detoxification. Various studies have demonstrated the effectiveness of lemon juice in increasing urinary citrate levels and preventing kidney stone formation. For instance, a study published in the Journal of Urology found that patients who consumed lemon juice regularly had significantly higher urinary citrate levels, reducing their risk of kidney stone recurrence. Experts often recommend lemon water as a natural and effective way to support kidney health and prevent stone formation. It's a simple addition to your daily routine that can have significant benefits for your kidneys. So, how can you incorporate more lemons into your diet? 1. Lemon water. Start your day with a glass of warm lemon water. Squeeze half a lemon into warm water. This simple drink can help kickstart your metabolism and support kidney detoxification. 2. Salad dressings. Use lemon juice as a base for salad dressings. Combine it with olive oil, a pinch of salt, and your favorite herbs for a fresh and tangy dressing. 3. Flavor enhancer. Add a slice of lemon to your tea or water for an extra boost of vitamin C and a refreshing flavor. As we've explored, cranberries, watermelon, and lemons each offer unique and powerful benefits for kidney health. Regularly consuming cranberries, watermelon, and lemons can enhance your body's natural detoxification processes and support overall kidney health. But remember, while these fruits are powerful allies in maintaining kidney health, they are not a substitute for medical care. If you're experiencing symptoms of kidney disease or have concerns about your kidney health, it's crucial to consult with a healthcare professional. Signs of kidney disease can include changes in urination patterns, swelling in the legs, ankles, or feet, fatigue, and persistent itching. If you notice any of these symptoms, don't hesitate to seek medical advice. For those already dealing with kidney issues, including chronic kidney disease, or those on dialysis, it's important to work closely with your healthcare provider or a registered dietitian. They can help you create a kidney failure patient diet chart that incorporates these kidney-friendly fruits in a way that's safe and beneficial for your specific condition. Thank you for joining us on this journey through the world of kidney health and nature's fruity defenders. We hope you found this information helpful and inspiring. Before we end this video, don't forget to like, share, and subscribe for more healthy tips. Why am I urinating every 2 hours? Possible causes. Before we get into the causes, it's good to know that needing to pee every 2 hours can be normal for some people. As you get older, you will need to urinate more often, and it's normal to wake up occasionally during the night to urinate. For instance, in your 40s and 50s, waking up once a night to go to the bathroom is typical. In your 60s and 70s, it might be twice a night, and in your 80s and beyond, it could be 2 to 3 times. However, waking up too often at night to urinate, also known as nocturia, can disrupt your sleep and may indicate a health issue, such as heart disease, sleep disorder, and swelling. Sometimes, the increased urination frequency comes with kidney pain. By kidney pain, we mean that dull ache in your back, stomach area, or lateral sides. Kidney pain results from various diseases. Most of these diseases also result in frequent urination, or feeling the urge to urinate every 2 hours. But if you experience pain along with frequent urination, it may not always be kidney-related. Pain at the start or during urination points to a urethral issue, while pain after urination suggests problems in the bladder or prostate. These issues can be associated with kidney pain due to the close proximity of the bladder, prostate, and urethra to the kidneys. Whether you feel the pain or not, there are multiple reasons for frequent urination. These can be due to kidney or bladder problems or non-renal diseases. Now, let's see the possible causes of frequent urination. 1. Urinary tract infections, or UTIs in short. The urinary tract is the pathway from the kidneys to the urethra that moves urine from the inside to the outside of the body. It starts in the kidneys, where urine is formed, and then passes through the ureters to the bladder, where it's stored. Finally, urine is expelled from the body through the urethra. Infection of any part of the urinary tract is one of the most common reasons for frequent urination and is associated with pain. It can be kidney infection, also known as pyelonephritis, bladder infection, also known as cystitis, and urethra infection, also known as urethritis. To give you an idea, infection leads to inflammation, which can irritate the lining of the urinary tract, leading to a greater urge to urinate. Also, to flush out the bacteria causing the infection, your body may increase urine production. Other than frequent urination, other symptoms of UTIs are pain in the groin or lower abdomen, bloody or cloudy urine, pain while passing urine, also known as dysuria, nausea, fever, or chills. Are you enjoying our videos so far? If so, please give us some hints by dropping a like, and we'll make more content like this. 2. Kidney diseases. If you think that you need to urinate more often, especially at night, also known as nocturia, this may indicate there's a problem with how your kidneys are filtering urine. More specifically, it can be related to an issue with the kidney's filtration system, and you may have a kidney disorder. Your kidneys are like the body's natural filters, helping to remove waste and excess fluids by creating urine. Normally, your kidneys do a great job of concentrating urine by reabsorbing water back into the bloodstream. However, if the kidneys get damaged, their ability to concentrate urine diminishes. This means they can't reabsorb water as effectively, leading to the production of larger volumes of dilute urine. This increased volume means that one needs to urinate more frequently. 3. Bladder issues. 3. Bladder issues. When you urinate frequently, it can sometimes be due to problems with the bladder. One common issue is the presence of stones in the bladder. These stones can cause several symptoms, including difficulty urinating, pain during urination, and lower abdominal pain. These symptoms can make it hard to fully empty your bladder, leading to a frequent urge to use the bathroom to pass urine. Another concerning issue is bladder pain syndrome, also known as interstitial cystitis. This is a chronic condition where people experience ongoing pain in the lower abdomen for weeks. This pain is often accompanied by a frequent need to urinate. The exact cause of this condition is not fully understood, but it may involve a defect in the immune system, similar to autoimmune disorders or allergic reactions. Sometimes, frequent urination can signify a more severe issue, such as bladder cancer. This cancer can also present with lower abdominal or back pain and blood in the urine. For urethral stricture. The urethra is the last part of the urinary tract that is responsible for draining urine out of the body. Sometimes it can become narrow due to injuries or infections, and this condition is known as urethral stricture. This narrowing can lead to difficulty when urinating, often causing the need to run to urinate again and again because you cannot completely pass all the urine out in one go. The next reasons on our list might not be directly related to a urinary tract condition, but they can still be common and worrisome. 5. Prostate problems. Another common reason for needing to urinate more often is benign prostatic hyperplasia, or BPH in short, which affects the prostate gland in males. The gland, located just below the bladder, plays a role in producing semen, also known as male fluid containing sperm. As men age, it's common for this gland to get enlarged, producing urinary symptoms. The most common symptom of BPH is an increase in the frequency of urination and difficulty controlling or retaining urine. Simply put, an enlarged prostate can obstruct the flow of urine from the bladder, causing incomplete emptying, just like the case of urethral stricture, and consequently, frequent urination. Additionally, a prostate infection, also known as prostatitis, can cause you to feel the need to urinate frequently. This condition can also make urination painful. For those interested in the evidence, the studies supporting our claims are provided in the link in our description box. 6. Vaginal issues. We've discussed how infections in the urinary tract or prostate can lead to more frequent trips to the bathroom. Similarly, vaginal infections, also known as vaginitis, whether from bacteria or yeast, can also increase the need to urinate. Another possible cause is anterior vaginal prolapse, also known as sister seal. It is a condition where the bladder drops from its normal position and pushes against the front wall of the vagina. This happens because the pelvic floor muscles, which support the bladder and other pelvic organs, become weakened or stretched. Because the bladder is displaced and not fully supported, it can cause a sensation of needing to urinate more often. But why do sister seals occur? The common reasons for pelvic floor weakness and bladder displacement are chronic constipation, multiple childbirth, or heavy weightlifting. Besides causing recurrent urination, sister seals can also lead to pressure symptoms in the pelvis. 7. Pregnancy. As the baby grows during pregnancy, the uterus expands to accommodate the developing fetus. 7. Pregnancy. The bladder, which sits below the uterus, gets pressed upon by the growing uterus, which takes up more space. This pressure reduces the bladder's capacity to hold urine, resulting in an increased frequency of urination. 8. Neurological disorders. Our nervous system contains a network of nerves that regulate bladder function. These nerves normally communicate between the bladder and the spinal cord and brain, instructing the bladder muscles to contract or relax in order to store or release urine. However, conditions like neurological disorders, stroke, and spinal cord injuries disrupt these nerves. This disruption often results in frequent urination and loss of control in holding urine. 9. Diabetes. 9. Diabetes. Diabetes is a chronic condition where there is an excess of glucose in the bloodstream. We may all know that the kidneys play a crucial role in filtering blood. So, when there's excess glucose in the blood, the kidneys need to work harder to filter it out and excrete it through urine. That's why people with type 1 and type 2 diabetes urinate more frequently. Also, diabetes is a major cause of kidney damage. High blood sugar from diabetes can damage the kidney's small blood vessels, making it hard for the kidneys to filter properly. As we discussed earlier, kidney damage is a common cause of increasing the urge to urinate. 10. Medications. Some medicines involve increasing the urine output. Diuretics, which help with conditions like fluid retention or swelling, is an expelling example. These drugs help the kidneys remove excess water and salt from the body through urine, increasing the frequency of urination. Remember, some common medications can impact kidney health, such as NSAIDs for inflammation, antibiotics for infections, or PPIs for acid reflux. We can't cover all of them in this video, but you'll find a detailed explanation in the video on the screen. We also shared tips for using them safely. 11. Your drinks. Sometimes, after a tough workout, sauna session, or a hot day out, you might find yourself drinking more than usual. If you end up needing to urinate more often during those times, don't worry. Your body and kidneys are doing their job well. Increased urination in this case simply means more fluid and equals more fluid out. Also, note that drinking alcohol and caffeine also increases the frequency of urination. However, there is no exact limit yet at which urinary frequency gets disturbed by these drinks. When to see your doctor. Earlier in the video, we mentioned that not every instance of frequent urination is cause for concern. However, there are some signs you should pay attention to. If frequent urination is accompanied by high fever and chills, seek medical help. It could indicate an infection. Also, don't ignore symptoms like one-sided pain, lower abdominal or back pain, painful urination, also known as dysuria, or blood in your urine, or hematuria, alongside frequent trips to the bathroom. And if you notice a vaginal or penile discharge, especially if it resembles pus, it is a clear sign to see your doctor. Some people may ask if seeing urine color would help to diagnose kidney disease. The answer is no, as damaged kidneys do not change the color of urine most of the time. However, when kidneys fail, urine could appear frothy or foamy due to the presence of protein. Foamy urine is also an early symptom of kidney disease, so be mindful of that. Other than this, there is no specific variation in the color of urine when the kidneys fail. If you can't pinpoint why you're urinating more often lately, like changes in how much you drink or drinks like alcohol or caffeine, it's also a good idea to talk to your doctor. This is especially important if it's affecting your sleep. During your visit, your doctor will ask about your fluid intake, medications you are taking, your drinking habits, if there is any swelling in your feet, for how long you have been experiencing this. And if you've experienced associated symptoms such as burning or pain when urinating, they might also ask about your history of fevers and whether you snore. It's good to think about these details before your appointment to help your doctor better understand your situation. Possible treatments for frequent urination. Once your doctor diagnoses your condition, they'll discuss possible treatment options with you. Just like with any symptom, the treatment for frequent urination will depend on what's causing it. For instance, urinary tract infections, or UTIs in short, are typically treated with antibiotics. and as the infection clears up, your urination frequency should return to normal. However, antibiotics can affect your kidneys, so it's wise to discuss your dosage with your doctor, and focus on eating more kidney-friendly foods, which we will mention later in this video. If bladder pain syndrome is the cause for your increased trip to the bathroom, opt for healthy lifestyle changes such as stress reduction, dietary changes, exercises, and bladder retraining techniques. Note that bladder cancer and urethral stricture require expert opinion to provide you relief and may involve surgical intervention in most cases. Now, benign prostatic hyperplasia, or BPH in short, can be treated with medications that ease obstruction. In refractory cases require surgical excision of enlarged prostatic tissue. If diabetes is the cause, it's important to properly manage your glucose intake. For anterior vaginal prolapse, Kegel exercises or pelvic floor exercises can be helpful. Also, frequent urination during pregnancy can be managed with pelvic floor exercises, high fiber intake, and limiting fluid after dinner. And before opting for any treatment, don't forget that fluid modification and tracking what kind of drinks you consume daily also help devise ways to reduce frequent urination. Home remedies for frequent urination. When it comes to home remedies, there's not much you can do to reduce frequent urination, except if it's due to your drinking habit. You can keep a diary to monitor the exact frequency of urination. This will also help find the cause. It's important to consult your doctor. But you can use some home remedies to support your treatment if you have any of the conditions we mentioned earlier. The best thing you can do is to cut down on caffeinated drinks, alcohol, and sodas. Also, try not to drink water a few hours before bedtime to avoid those late-night trips to the bathroom. Also, you can try bladder retraining techniques. These involve gradually trying to hold urine for increasing intervals, which will help build bladder capacity. Another suggested exercise is the pelvic floor exercises, which are particularly important for elderly women. It will strengthen the muscles of the bladder and its holding capacity, like the bladder retraining techniques. In case of frequent urination owing to UTIs, some simple home remedies to get rid of them are increased garlic intake, cranberry juice, and probiotics. Though more research is needed in this domain. Also, avoid citrus and acidic foods, which may irritate your bladder if you have an infection. How to prevent kidney diseases. Preventing kidney disease mostly comes down to making healthy lifestyle choices. It's important to keep yourself physically active, so try to do at least 30 minutes of exercise per day. If you are obese or overweight, aim to reduce weight to save yourself from a lot of diseases, including kidney diseases. Also, if you drink or smoke, try to cut back, and if you don't, it's best not to start. You should not drink more than 1 drink of alcohol per day if you are female and more than 2 drinks a day if you are a male. Try to seek help if you are having a hard time quitting smoking. One more important thing to prevent kidney disease is managing your other conditions. For example, hypertension, 120/80 millimeters of mercury, is one of the most common reasons for kidney damage. Get your blood pressure checked regularly and seek medical attention if found above the normal range. If it is in the normal range, some lifestyle tips can prevent it from getting higher, such as reducing salt intake, exercising, and dietary changes. Plus, managing your blood sugar levels is also important, as diabetes affects the kidneys a lot. Complying with your diabetes medicines, lifestyle modification, and regularly monitoring your blood sugar can save you from kidney diseases. It's best to avoid excessive use of over-the-counter painkillers or OTC analgesics. Painkillers, such as NSAIDs, can damage the blood vessels of the kidneys, so use them cautiously and ask your doctor about the quantity that is allowed for your disease or pain. Healthy food that protects your heart and kidneys include fresh fruits and vegetables, whole grains, fat-free dairy products. Try to 10% of your daily calories and limit sodium, which is abundant in salt, to less than 2.3 grams per day. You can use spices to replace salt, to add taste to your food, and try to bake or broil your meat instead of frying it. Water is the best drink for your kidneys. Water has 0 calories and is best for hydration and normal functioning of the body as well. To quench your thirst, try to prefer water over anything else, particularly when you're at risk of having a kidney disease. In this video, you learn frequent urination can be due to renal or non-renal diseases. Important causes of increased frequency of urination are urinary tract infections, or UTIs, benign prostatic hyperplasia, or BPH, bladder stones, urethral stricture, bladder cancer, diabetes, pregnancy, vaginal prolapse, and increased water intake. It is important to consult your doctor if you notice frequent urination with blood in urine, lower abdominal pain, fever, chills, or vomiting. Possible treatment of frequent urination depends upon its cause, such as antibiotics for UTIs and surgical intervention for cancer and urethral strictures. Home remedies for frequent urination include fluid modification, bladder retraining techniques, pelvic floor exercises, and the avoidance of citrus foods. Dietary changes, exercises, controlling blood pressure and sugar levels, and avoiding painkillers can all help prevent kidney disease. Now, we want to send a big thank you to all our current subscribers and viewers. Your support inspires us to continue sharing valuable content. Hit the bell icon and turn on all notifications so you never miss a life-saving video. If you are suffering from kidney disease, you need to modify your diet, which helps fight the damage present there. These include strawberries, red bell peppers, low-phosphorus cheese, pomegranates, blueberries, avocados, tofu, fish, root vegetables, broccoli, beans, etc. For more details, you can watch the video on the screen. Here, we share the top 6 superfoods to heal kidney disease. We also offer tips on how to still enjoy them or find great alternatives. See you there. Stay informed, stay healthy. Did you know that millions of people are silently suffering from kidney issues without even realizing it? Right here in the United States, an alarming number of individuals face kidney-related challenges, many of which go unnoticed until it's too late. Your kidneys, those vital organs tucked away out of sight, play a critical role in your overall health. They're your body's natural filtration system, tirelessly working 24/7 to remove waste and excess fluids from your blood. They keep everything from your blood pressure to your mineral levels in perfect balance. But here's the catch. Kidney damage is a silent process. By the time symptoms become noticeable, considerable damage might already have been done. That's why understanding and recognizing the early warning signs your body is sending could be a game changer for your health. Today, we're diving deep into the silent signs that could indicate your kidneys are in distress, underscoring the vital importance of kidney health. Stay with us to uncover what your body might be trying to tell you. Sign number 1, fatigue and weakness. When the kidneys are damaged, their ability to perform critical functions, including the production of the hormone erythropoietin, is compromised. Erythropoietin plays a pivotal role in the body's mechanism for producing red blood cells. These cells are essential for transporting oxygen from the lungs to the rest of the body, providing the energy needed for various bodily functions. As kidney function deteriorates, the production of erythropoietin decreases, leading to a significant reduction in the production of red blood cells, a condition known as anemia. Anemia associated with kidney damage manifests through symptoms of fatigue and weakness, which occur because the body's tissues and organs are not receiving an adequate supply of oxygen. This oxygen deficiency means that even normal activities can become exhausting, as the body is unable to generate the energy needed to perform tasks. Individuals may feel tired all the time, irrespective of how much they rest. This persistent fatigue significantly impacts one's quality of life, making even simple everyday activities challenging to accomplish. Understanding the link between kidney damage, decreased erythropoietin production, and anemia is crucial. It highlights the importance of early detection and management of kidney issues. To prevent the onset of fatigue and weakness and maintain overall health and well-being. Sign number 2, changes in urination. Changes in urination are key indicators of kidney health, signaling potential problems when they deviate from normal patterns. The kidneys play a vital role in filtering waste from the blood and regulating urine production. When they are damaged or not functioning properly, various symptoms related to urination can arise, including changes in frequency, the appearance of blood, pain during urination, and alterations in the amount of urine produced. Frequent urination might mean the body is trying to eliminate excess waste or fluids. A task made more difficult if the kidneys are impaired. Conversely, less frequent urination could suggest the kidneys are not filtering blood as effectively as they should, leading to less waste being processed into urine. Painful urination is often a sign of infection or inflammation in the urinary tract, which can also affect the kidneys and exacerbate existing kidney problems. The presence of blood in the urine, a condition known as hematuria, is particularly alarming as it indicates potential damage to the kidney's filtering system. This damage can allow red blood cells, which are normally kept in circulation, to leak into the urine. These symptoms, ranging from changes in urination frequency to the appearance of blood, underline the importance of monitoring urinary habits as a reflection of kidney health. Identifying and addressing these symptoms promptly can be crucial in diagnosing and managing underlying kidney issues before they progress further. Sign number 3, swelling in ankles, feet, or hands. When the kidneys are healthy, they effectively remove excess fluid and waste from the body, maintaining a balance that prevents swelling. However, when the kidneys are failing, their ability to perform this critical function diminishes. As a result, excess fluid starts to build up in the body, leading to swelling, a condition medically known as edema. This swelling is most noticeable in the ankles, feet, and hands, areas that quickly show the effects of fluid retention. Swelling caused by kidney failure is not just a superficial issue. It's a sign that the kidneys are not able to manage the body's fluid balance, which can have a cascade of health implications. The retention of fluid not only affects the appearance of the ankles, feet, and hands, but can also put additional strain on the heart and blood vessels, contributing to hypertension, high blood pressure, and further complicating kidney health. This symptom underscores the importance of kidney function in overall health and well-being. Swelling in the ankles, feet, or hands should not be ignored as it is a tangible sign that the kidneys may be under distress. Early recognition and treatment of kidney issues can help manage symptoms like swelling and prevent potential complications, highlighting the crucial role of kidneys in managing fluid balance and maintaining health. Sign number 4, puffy eyes. Puffy eyes can be an unexpected indicator of kidney issues, particularly when linked to the presence of protein in the urine, a condition known as proteinuria. Under normal circumstances, the kidneys filter waste from the blood while retaining essential components, including proteins. When the kidneys are damaged, their filtering abilities are compromised, allowing proteins that should be retained in the bloodstream to leak into the urine. This loss of protein can lead to a series of reactions in the body, one of which is fluid retention. The area around the eyes is especially prone to swelling because the skin is thinner and more sensitive to changes in fluid balance. Thus, when the body starts retaining fluid due to the loss of protein through the kidneys, it can manifest as puffiness around the eyes. Puffy eyes related to kidney damage are more than just a cosmetic concern. They signal a deeper problem with kidney function and the body's ability to maintain its delicate balance of proteins and fluids. Recognizing this symptom as a potential sign of kidney issues is crucial for early intervention and treatment. Addressing the underlying kidney damage can help alleviate proteinuria and its symptoms, including puffiness around the eyes, while also safeguarding overall health by restoring the kidney's filtering capabilities. Sign number 5. Dry and itchy skin. Dry and itchy skin can often be more than just a superficial irritation. It may indicate a deeper health issue, such as kidney failure. When the kidneys fail to function properly, they can't maintain the balance of minerals and nutrients in the blood. This imbalance can lead to a condition known as mineral and bone disease, which affects the health and integrity of the bones and skin. The kidneys play a critical role in processing and balancing minerals, such as calcium and phosphorus, in the body. They also help manage the levels of other important substances, including vitamin D, which is essential for bone health and maintaining the skin's moisture. Kidney failure disrupts this delicate balance, leading to changes in the skin's condition. The resulting mineral imbalances and the buildup of wastes in the blood can cause the skin to become dry, itchy, and irritated. This itchiness isn't relieved by regular moisturizers or creams because the problem isn't just on the skin surface. It's a manifestation of the internal issues caused by kidney failure. The dryness and itchiness are symptoms of the body's struggle to manage its mineral content and eliminate waste effectively. Addressing dry and itchy skin caused by kidney issues involves more than just topical treatments. It requires medical intervention to manage the underlying kidney condition and restore the balance of minerals in the body. Effective treatment of kidney failure can alleviate the symptoms, including the uncomfortable skin conditions, underscoring the importance of kidney health for overall well-being. Sign number 6, metallic taste in mouth. When the kidneys are healthy, they filter out waste materials from the blood. But if they're not working well, these wastes can build up, leading to a condition known as uremia. One of the lesser-known but distressing symptoms of uremia is a metallic taste in the mouth. This unpleasant taste sensation is not just a random occurrence. It's directly related to the accumulation of toxins and waste products in the bloodstream that the kidneys fail to eliminate. This buildup of wastes can affect various bodily functions, including taste and smell. When the concentration of these waste products becomes high, it can alter the way food tastes, leading to that persistent metallic flavor. This change in taste can also be accompanied by bad breath, another side effect of the waste accumulation, further impacting a person's well-being and quality of life. The metallic taste in the mouth is more than just an annoyance. It's a signal from the body that the kidneys are struggling to perform their vital role of cleansing the blood. It's essential to recognize this symptom as a possible indicator of kidney issues, prompting medical consultation and testing. Addressing the underlying kidney dysfunction can help alleviate this and other symptoms related to uremia, improving the individual's overall health and well-being. Sign number 7, nausea and vomiting. Nausea and vomiting are common symptoms that can stem from a wide range of conditions, but when they are persistent without a clear cause, they might indicate a problem with kidney function. Specifically, these symptoms can arise from the buildup of waste products in the body, a condition that occurs when the kidneys are unable to adequately filter and eliminate toxins from the bloodstream. The kidney's primary function is to remove waste materials and excess fluids from the blood, which are then excreted through urine. When the kidneys are damaged or fail to work correctly, these waste products accumulate in the bloodstream, leading to a condition known as uremia. Uremia can have a wide-ranging impact on the body, including the gastrointestinal system. The accumulated toxins can irritate the stomach lining, leading to feelings of nausea or the urge to vomit. This discomfort is not just limited to the digestive tract. It's a systemic response to the increased levels of toxins that the kidneys are not filtering out. The presence of these toxins can trigger the brain's vomiting center, a complex mechanism involving multiple areas of the brain that coordinate the vomiting response. Addressing nausea and vomiting in the context of kidney disease involves treating the underlying kidney dysfunction to reduce the levels of toxins in the blood. This may require medical interventions such as medication, dialysis, or, in advanced cases, kidney transplantation to restore the body's ability to eliminate waste products effectively and relieve the symptoms of uremia. Sign number 8, shortness of breath. Shortness of breath, a distressing symptom affecting one's ability to breathe easily, can be a significant indicator of kidney damage. For this symptom may arise from two main issues related to kidney dysfunction: fluid buildup in the lungs and anemia, both of which are closely tied to the kidney's ability to maintain the body's fluid balance and produce red blood cells. Firstly, when the kidneys are damaged, their capacity to remove excess fluid from the body diminishes. Instead of being excreted, this fluid can accumulate in different parts of the body, including the lungs, a condition known as pulmonary edema. This accumulation in the lungs makes it harder for them to expand during breathing, leading to a feeling of breathlessness or shortness of breath. This symptom can be particularly noticeable during activities or even at rest in severe cases. Secondly, kidney damage affects the production of erythropoietin, a hormone crucial for the formation of red blood cells. A decrease in red blood cell production leads to anemia, a condition characterized by a reduced capacity of the blood to carry oxygen. With less oxygen available to meet the body's needs, muscles and organs, including the lungs, have to work harder to oxygenate the body, leading to fatigue and shortness of breath. Both these conditions, fluid buildup in the lungs and anemia, highlight the critical role kidneys play in regulating the body's fluid and blood cell levels. Addressing the underlying kidney issues is crucial to managing and alleviating shortness of breath, underscoring the importance of early detection and treatment of kidney damage. Sign number 9, feeling cold. Feeling persistently cold, even in warm environments, can be a puzzling and uncomfortable symptom. This sensation is often linked to anemia, a condition that can arise as a consequence of kidney disease. Anemia occurs when there is a shortage of red blood cells, which are responsible for carrying oxygen from the lungs to the rest of the body. When the kidneys are damaged, they produce less erythropoietin, a hormone that prompts the bone marrow to make red blood cells. As a result, the body ends up with fewer red blood cells, diminishing its ability to transport oxygen efficiently. Oxygen is essential for the production of energy in the body's cells, including those that regulate temperature. With less oxygen available, the body struggles to generate sufficient heat, leading to feelings of coldness. This symptom can be particularly noticeable in the extremities, such as the hands and feet, but can also affect the individual's overall sense of warmth. The link between kidney disease and feeling cold is a critical reminder of the kidney's role beyond filtering waste. They are also crucial in maintaining the body's delicate balance of red blood cells. Addressing the root cause of anemia through treatments aimed at improving kidney function can help alleviate this persistent coldness, improving the individual's comfort and quality of life. Sign number 10, dizziness and trouble concentrating. Dizziness and trouble concentrating are symptoms that can significantly impact daily life, often making even simple tasks feel challenging. These symptoms can sometimes be linked to anemia, a condition characterized by a lower than normal count of red blood cells, which is common in individuals with kidney disease. Anemia results from the kidney's reduced ability to produce erythropoietin, a hormone that signals the bone marrow to produce red blood cells. These cells are responsible for carrying oxygen throughout the body, including to the brain. When the brain doesn't receive enough oxygen because of a reduced number of red blood cells, it can lead to symptoms like dizziness and difficulties with concentration. Oxygen is essential for brain function, fueling brain cells and helping them work efficiently. Without adequate oxygen, cognitive functions such as memory, attention, and the ability to process information can be impaired. Manifesting as trouble, concentrating and feeling lightheaded, or dizzy. These symptoms can be especially troubling because they affect an individual's ability to perform everyday activities, impacting their quality of life. Recognizing and treating anemia in the context of kidney disease is crucial. Treatments may include medications to increase red blood cell production, supplements to address deficiencies such as iron, vitamin B12, or folic acid, and in some cases, dialysis or kidney transplantation to improve kidney function. Proper management of anemia can help alleviate these symptoms, improving oxygen flow to the brain and enhancing overall cognitive function. Sign number 11, pain in the lower back. Pain in the lower back, particularly in the area where the kidneys are located, can be a sign of underlying kidney problems. This discomfort may range from a dull ache to sharp, severe pain and can indicate conditions such as polycystic kidney disease, PKD, or kidney stones. Polycystic kidney disease is a genetic disorder characterized by the growth of numerous cysts filled with fluid in the kidneys. These cysts can enlarge the kidneys and disrupt their function, leading to pain in the back or sides. The pain is often caused by the pressure from the growing cysts, the stretching of the kidney or surrounding tissues, and sometimes by cyst infections or bleeding. Kidney stones, on the other hand, are hard deposits of minerals and salts that form inside the kidneys. When these stones move through the urinary tract, they can cause excruciating pain, often described as one of the most severe types of pain imaginable. This pain, known as renal colic, can be felt in the back, lower abdomen, or groin. Both conditions affect kidney function and can lead to further complications if not treated. It's important for individuals experiencing persistent or severe lower back pain, especially when accompanied by other symptoms like changes in urination, blood in the urine, or fever, to seek medical evaluation. Early diagnosis and treatment of kidney-related back pain can prevent complications and preserve kidney health. Sign number 12, high blood pressure. High blood pressure, also known as hypertension, is a common health condition where the force of the blood against your artery walls is consistently too high. The kidneys play a critical role in regulating blood pressure through a balance of salt and fluid in the body. They filter your blood, removing excess salts and water, which can affect blood pressure levels. The kidneys use a complex system of hormones and enzymes to communicate with other organs and manage blood pressure effectively. When the kidneys are damaged, their ability to regulate these processes is impaired. This can lead to an accumulation of salt and fluid in the body, causing blood pressure to rise. Additionally, kidney damage can lead to a reduced production of substances that help dilate blood vessels, further contributing to increased blood pressure. High blood pressure, in turn, can create a vicious cycle by causing further harm to the kidneys. Elevated pressure in the blood vessels can damage the tiny blood vessels in the kidneys, reducing their filtering ability. This damage can exacerbate kidney disease, leading to a worsening of both kidney function and blood pressure control. Managing high blood pressure is crucial for maintaining kidney health and preventing further damage. This can involve lifestyle changes such as diet and exercise, as well as medication to control blood pressure. Regular monitoring and treatment of high blood pressure are essential steps in preventing kidney damage and maintaining overall cardiovascular health. Next, I will talk about preventative measures for silent signs of kidney disease. Preventative measures for maintaining kidney health and preventing issues like high blood pressure involve a combination of lifestyle changes and regular health checkups. Adopting a balanced diet low in salt and processed foods and rich in fruits, vegetables, and whole grains can significantly impact kidney health. Regular physical activity helps maintain a healthy weight and manage blood pressure. Staying hydrated, limiting alcohol consumption, and avoiding smoking are also crucial. Regular monitoring of blood pressure and blood sugar levels can catch potential problems early. Finally, annual checkups with your healthcare provider allow for early detection and management of any kidney-related issues, safeguarding your overall health. Before we wrap up, if you found this information helpful, please take a moment to like and share this video. Spreading awareness about kidney health is crucial, and your share could help someone recognize the signs early and seek the help they need. If you've experienced any of these symptoms or have tips on maintaining kidney health, we'd love to hear from you in the comments below. Your insights could provide great support and information to others. Don't forget to subscribe to our channel for more health-related content. By staying informed, we can all take better care of our health and prevent issues before they arise. Thank you for watching, and let's continue to support each other in leading healthier lives. Avoid these 7 plant-based foods that can damage your kidneys. In recent years, many experts have suggested the benefits of a plant-based diet in reducing the strain on your kidneys. But just because something is from a plant doesn't mean it's good for your kidneys, particularly if you have kidney disease. In reality, some plant-based foods can actually pose risks, and cutting back on them would bring lasting rewards. Watch this video to learn 7 plant-based foods you should avoid to protect your kidneys. Before we dive in, please note all the information in this video is created by real people, thoroughly fact-checked, unbiased, and reviewed by qualified professionals. 7. Seed oils. Seed oils are plant-based cooking oils obtained from seeds. Examples are rice bran, canola, corn, cottonseed, grapeseed, soybean, sunflower, safflower, and peanut oils. These oils are promoted as valuable lipid sources due to their healthy fatty acid content and bioactive compounds. However, these oils have undergone extensive processing, including bleaching, refining, and heating, to extract and clean them before they can be used for cooking and baking. Refining can strip away essential nutrients like antioxidants and sometimes produce unwanted compounds. One example is trans fatty acids, one of the most harmful compounds for your kidneys and overall health. More concerning, seed oils can contribute to inflammation in the body due to their high omega-6 fatty acid content. Inflammation is the root cause behind a long list of health conditions like kidney disease, arthritis, heart disease, and diabetes. Small amounts of omega-6 fatty acids are necessary for your overall health. However, excessive consumption, typical in Western diets, can disrupt the balance between omega-6 and omega-3 fatty acids, leading to health problems such as kidney damage. Fats are divided into saturated and unsaturated types. Unsaturated fats found in oils like olive oil are healthier, offering benefits such as improved cholesterol and heart health. Saturated fats found in animal products and some plants like coconut should be limited. Replacing saturated fats with unsaturated ones can minimize the harm caused by seed oils. Opt for unrefined oils, such as extra virgin olive oil, which retain more natural nutrients, flavor, and aroma. Because they are extracted using methods like cold pressing without high heat or chemicals, unrefined oils are tastier, healthier, more natural, and free from harmful additives. This purity and nutrient retention support overall health, including kidney function. 6. Canned vegetables and canned soups. Canned soups and vegetables are commonly consumed because of their low cost and convenience. However, these foods typically contain high levels of sodium for preservation, which can be problematic for those with kidney disease. When the kidneys are not functioning properly, they cannot effectively filter out excess sodium from the blood. This leads to a buildup of sodium, which can increase blood pressure and put additional strain on the kidneys. It is worth emphasizing that canned foods often contain added sugars or chemical additives. This is why individuals with kidney disease should avoid or limit canned foods, including canned vegetables. Instead, look for fresh or low-sodium alternatives. Are you enjoying our video so far? If so, please give us some hints by dropping a like, and we'll make more content like this. 5. Chips and pretzels. Baked chips, despite their reputation as a healthier alternative to the fried version, can still pose risks to kidney health. Baked chips are highly processed and low in fat, making it easy to overeat without feeling full. Pretzels are processed baked bread snacks, which can raise blood sugar levels and promote fat storage. These effects can contribute to kidney damage over time. Potato chips and pretzels are also low in essential nutrients like fiber and protein, and can contribute to weight gain and obesity, potentially damaging your kidneys over time. Worse still, both chips and pretzels can contribute to high sodium intake, which can strain the kidneys by causing fluid retention and elevated blood pressure. High salt intake may worsen already existing kidney damage and increase the risk of cardiovascular complications like heart attacks and strokes. Try to moderate your intake of these foods in favor of healthier snack options to support kidney health. 4. Ketchup. Ketchup is made from tomatoes, which are high in potassium, and excessive potassium intake can be problematic for those with poor kidney function. Also, ketchup is often high in added sugar and sodium, which can contribute to high blood pressure and strain on the kidneys. 1 tablespoon, which is 17 grams, can contain 180 milligrams of sodium and 4 grams, which is equivalent to 1 teaspoon of sugar. It's best to choose options that are low in these ingredients, especially those that don't include high fructose corn syrup. The sugar in ketchup, like high fructose corn syrup, can lead to obesity and insulin resistance, making kidney function worse. Ketchup also has lots of phosphorus, which isn't good for individuals with kidney issues. Too much phosphorus can cause problems since damaged kidneys struggle to filter it out. It's important to avoid other store-bought condiments that might cause similar adverse effects. This includes salad dressing, barbecue sauce, and soy sauce, as they often contain high levels of sodium, sugars, or chemical additives. Rather than topping your favorite summer dishes with these condiments, consider using salsa. Choose fresh, salt-free salsa from the store, or make your own at home. For those interested in the evidence, the studies supporting our claims are provided in the link in our description box. 3. Instant noodles. Instant noodles are pre-cooked, dried noodles that are popular worldwide due to their convenience, long shelf life, variety of flavors, and reasonable cost. However, they are often criticized for being unhealthy due to their high sodium, carbohydrate, and trans fat content, and lack of essential nutrients like fiber, vitamins, and minerals. In 2017, Nutrition Research and Practice published a study involving 397 college students in Seoul, aged 18 to 29. The study aimed to understand how eating instant noodles affects heart and metabolic health. They found frequent instant noodle intake was linked to elevated levels of blood triglycerides and sugars and increased blood pressure. These effects can potentially cause diseases that lead to kidney damage. Instant noodles are a perfect example of ultra-processed foods, or UPFs for short, which can damage kidney function. UPFs are typically high in calories, refined carbohydrates, sugar, salt, chemical additives, and trans fats, and low in dietary fiber and essential nutrients. A 2022 study published in the American Journal of Kidney Diseases analyzed data from the Atherosclerosis Risk and Communities Study, a major research initiative conducted in the United States. This study involved 679 middle-aged adults without kidney disease at baseline. After analyzing, the researchers found that each additional serving of ultra-processed foods, including canned soup, was linked to a 5% higher risk of chronic kidney disease, or CKD for short. These findings highlight the potential harm of canned soup and other ultra-processed foods on kidney health. A study conducted in Korea found that people consuming the most UPFs had a higher prevalence of CKD. The results demonstrated that every 6% increase in UPF consumption was linked with a 6% higher prevalence of CKD. This association may be due to the harmful ingredients found in UPFs, such as hydrogenated oils and chemical additives, which can cause oxidative stress and inflammation. Frequent consumption of instant noodles can harm the kidneys due to their high phosphorus content, which can raise serum phosphorus levels. Elevated serum phosphorus is linked to increased mortality and cardiovascular events. Efforts are being made to address these concerns and develop healthier versions. In Malaysia, for example, researchers have explored the use of composite flours, incorporating locally available ingredients like seaweed powder to improve the nutritional value and quality of instant noodles, while reducing dependence on imported wheat flour. 2. Frozen meals. Pre-packaged vegan-vegetarian frozen meals frequently contain lots of salt, potassium, and phosphorus, which can be bad for patients with kidney disease. Excess salt and other preservatives are often added to make these meals taste better and last longer. Moreover, excessive potassium intake can be problematic for individuals with compromised kidney function, as mentioned earlier, because the kidneys struggle to properly regulate potassium levels in the blood. However, plant-based diets in kidney disease have been shown to be beneficial, as the potassium in fresh whole plants are paired with fiber, which prevents its absorption. Talk with your dietitian about the right plant-based diet for you. Similarly, additives containing phosphorus in processed frozen foods can contribute to elevated phosphorus levels in the blood, potentially leading to bone and heart complications in those with kidney disease. Therefore, frozen meals are generally not a good choice for people concerned about kidney health, especially if consumed regularly. To make frozen meals less harmful to kidney health, choose those with lower sodium and reduced potassium and phosphorus content. This involves carefully reading labels and selecting products with minimal processed ingredients. A better option is to prepare homemade meals using fresh whole food ingredients, allowing for greater control over nutrient intake. Try cooking large batches of kidney-friendly vegetarian or vegan dishes and freezing individual portions for later consumption. By prioritizing fresh, whole foods and mindful meal planning, you can enjoy a kidney-friendly diet while minimizing potential harm. 1. Chocolate bars or energy bars. While cocoa contains phenolic antioxidants and flavonoids that can help support the function of your blood vessels, chocolate bars should be consumed with caution. Chocolate bars have high levels of saturated fats and added sugar. These components contribute to high blood sugar, high blood pressure, and weight gain, which are common triggers for kidney disease. Chocolate bars and energy bars are also considered UPFs, which are linked with an increased risk of CKD and worsen complications in patients with CKD. As mentioned earlier, UPFs are typically high in energy, low in nutritional value, and contain additives that may be harmful to kidney health. Energy bars, often consumed for replenishing electrolytes lost during exercise, can pose significant dangers to kidney health. Similar to energy drinks, they often contain high amounts of sugar to provide a quick energy boost. Also, the combination of high sugar and other additives in energy bars leads to conditions that can cumulatively strain the kidneys. Thus, long-term consumption of energy bars can accelerate kidney damage. Therefore, it is essential to minimize your consumption of these processed bars and consider fresh fruits and other healthier alternatives. Are your kidneys damaged? Healthy kidneys filter about half a cup of blood each minute, getting rid of waste and excess water to produce urine. The urine travels from the kidneys to the bladder through two thin muscular tubes called ureters. One on each side of the bladder. The bladder serves as a reservoir, temporarily storing the urine. Together, the kidneys, ureters, and bladder make up the urinary system. When your kidneys are damaged, waste and fluid build up. Over time, this can lead to kidney disease and kidney failure, which can be either acute or chronic. Acute kidney failure is usually short-term and reversible, while chronic kidney failure is a long-term condition that is progressive. Symptoms of kidney damage can include nausea, vomiting, fatigue, sleep problems, changes in urination, decreased mental sharpness, muscle cramps, swelling of feet and ankles, itchy skin, and high blood pressure. These signs might not manifest until irreversible damage has occurred due to the kidney's ability to compensate for lost function. Kidney problems can cause anemia and bone and mineral disorders, such as hyperkalemia, which can be deadly. Additionally, kidney failure can heighten the risk of heart disease or stroke. Without treatment, kidney failure is fatal. Doctors rely on biomarkers like creatinine levels, glomerular filtration rate, or GFR, and protein in the urine to assess kidney function. Newer biomarkers such as kidney injury molecule and neutrophil gelatinous-associated lipocolin show promise for early detection of kidney damage. Triggers for kidney disease include high blood pressure, high blood sugar, and high blood cholesterol levels. The increased force from high blood pressure injures the filtering units of the kidneys. Elevated blood sugar from diabetes can cause damage to small blood vessels in the kidneys, which harms the filters. Additionally, cholesterol forms plaques along the artery walls, blocking blood flow to the kidneys, which impairs their function and also causes protein loss in the urine. Other diseases and environmental factors can also contribute to kidney damage. Obesity increases the risk of chronic kidney disease, or CKD, by lowering urine pH, causing chronic inflammation, and disrupting fat metabolism. It also worsens high blood pressure, insulin resistance, and glucose intolerance, further raising the CKD risk. While CKD can be caused by various factors, including diabetes and high blood pressure, dietary choices play a significant role. This video has highlighted some plant-based foods to avoid, emphasizing the importance of opting for less processed alternatives. The one thing all of these foods have in common is that they are processed. From seed oils to flavored instant oatmeal, many processed foods contain additives that can worsen kidney disease. To maintain healthy kidneys, swap out high-sodium condiments like ketchup for homemade sauces with fresh herbs. Opt for antioxidant-rich fruits and vegetables. Choose lean proteins with less saturated fat, and stay hydrated with water. By prioritizing whole, nutrient-rich foods and limiting processed options, you can support your kidneys and prevent pre-existing kidney conditions from getting worse. Remember, consulting with a healthcare professional is necessary. Especially if you have an existing kidney condition, your doctor and registered dietitian can provide personalized guidance to help you make informed dietary choices and maintain optimal kidney health. Now, we want to send a big thank you to all our current subscribers and viewers. Your support inspires us to continue sharing valuable content. Hit the bell icon and turn on all notifications so you never miss a life-saving video. Have you seen any signs from our video or worried about kidney disease? Your kidneys might need a natural boost. Check out the video on the screen for the top 5 fruits that can help cleanse your kidneys. We also offer tips to get the most from them. See you there. Stay informed. Stay healthy. 10 foods for kidney health. There are few organs in the body that one can lose one and still live a relatively healthy life with only one of those organs. Spleen, lungs, and kidney are few of these organs. However, living with 2 unhealthy or damaged of any of those organs can shorten your life drastically. In today's video, we will share healthy kidney foods that you must eat to keep your kidney healthy and functioning correctly. The kidney function is essential to your overall health because it is responsible for controlling the body's fluids. It also functions as the body's primary way to filter the blood and remove waste. Without a properly functioning kidney, your body could become overwhelmed by toxins, which could lead to severe conditions, if not death, to support your renal health. The best thing you can do is switch to a diet that is low in sodium, phosphorus, and potassium. Ideally, you would consume no more than 2,000 milligrams per day of sodium and potassium, and limit your phosphorus intake to 1,000 milligrams per day. That is because these minerals burden the kidneys and could overwhelm them enough to affect their function. Here are the top 10 foods for kidney health. 1. Apples. Apples are incredibly good at supporting optimal kidney function because they are rich in anti-inflammatory compounds. They are also rich in pectin, a soluble fiber that helps manage risk factors for kidney disease, including diabetes and high cholesterol. Additionally, a medium-sized apple only contains 1.8 milligrams of sodium, 195 milligrams of potassium, and 20 milligrams of phosphorus. 2. Bell peppers. Bell peppers are rich in antioxidants that help repair damage in the body. They are also full of vitamins, minerals, and fiber, which are essential to your overall health. For those concerned about kidney health, this is an excellent vegetable to eat because a medium-sized pepper only contains 4.8 milligrams of sodium, 251 milligrams of potassium and 39 9 milligrams of phosphorus, 3 blueberries. In 2014, researchers from Louisiana State University led an animal study on the effects of blueberries on renal function. They found that a diet enriched with blueberries has profound protective effects on the kidneys, mainly because of its remarkable antioxidant and anti-inflammatory properties. Plus, blueberries are an excellent addition to a kidney-friendly diet, because 1 cup contains only 5 milligrams of sodium, 114 milligrams of potassium, and 8 milligrams of phosphorus. 4. Cabbage. Cruciferous vegetables, in general, are beneficial to the body. Cabbage is an excellent source of phytochemicals that support organ health. Apart from being packed with fiber, it is rich in folic acid, vitamin B6, vitamin C, and vitamin K, all of which contribute to optimum renal health. Plus, 1 cup of shredded cabbage only contains 6 milligrams of sodium, 119 milligrams of potassium, and 2 milligrams of phosphorus. 5. Cauliflower. Cauliflower offers the same benefits that all cruciferous vegetables do, but apart from the fiber, vitamins, minerals, and phytochemicals, it is also rich in beneficial compounds called thiocyanates, glucosinolate, and indoles. These compounds are useful in flushing out toxins in the body and consequently, minimizing the load on the kidneys. Besides, half a cup of boiled cauliflower contains only 3 milligrams of sodium, 88 milligrams of potassium, and 58 milligrams of phosphorus. 6. Cranberries. According to the National Kidney Foundation, cranberries are beneficial to kidney health because it contains compounds that prevent unwanted bacteria and ulcers from reproducing in the urinary tract. So, consuming cranberries in any form helps minimize the risk of UTIs and protects the kidneys. Also, a cup of unsweetened cranberry juice only contains 1 milligram of sodium, 195 milligrams of potassium, and 9 milligrams of phosphorus. 7. Egg whites. Proteins generally place a heavy burden on the kidneys. That is why renal patients are often made to avoid red meat. But egg whites are an excellent source of proteins that do not affect the kidneys the same way meats do. That is because the whites of a single egg can give you up to 4 grams of protein with only 2 milligrams of sodium, 8 milligrams of potassium, and 9 milligrams of phosphorus. 8. Garlic. Garlic has been a staple in natural and traditional medicine for centuries. It is most useful for its antibiotic and anti-inflammatory properties, which are essential to kidney health. A study published by the Journal of Nutritional Biochemistry specifically showed the antioxidant effects of garlic supplementation within the body. That proved to have positive impacts on various organ functions, including the liver and kidneys. Additionally, 3 cloves of raw garlic only contain 5 milligrams of sodium, 1 milligram of potassium, and 8 milligrams of phosphorus. 9. Onions. As part of the allium family, onions have plenty of health benefits. But for kidney health specifically, it is useful for its flavonoid content, which helps minimize cellular damage. It is also rich in chromium, which boosts the metabolism of proteins, fats, and carbohydrates, and consequently, reduces the burden on the kidneys. Plus, a cup of sliced onions only contains 6 milligrams of sodium, 168 milligrams of potassium, and 3 milligrams of phosphorus. Raspberries. In 2011, researchers from the Jordan University of Science and Technology Orbit led an animal study on the effects of raspberries on the kidneys. They found that these berries have a prophylactic and therapeutic effect on kidney stones. But apart from having the impressive ability to eliminate kidney stones, it is also excellent for kidney health because 1 cup of fresh raspberries only contains 1. 2 milligrams of sodium, 186 milligrams of potassium, and 7 milligrams of phosphorus. Thankfully, the best foods to take for optimum kidney health are easy to find, relatively inexpensive and simple to incorporate into a healthy diet. Make sure you load up on these foods to give your kidneys the nutrition it needs to function correctly and to support your body for as long as possible. Following our study references we used in the creation of this video. Thank you for watching. And please subscribe to our channel if you haven't already done so. New subscribers, click on the bell icon when you subscribe. Old subscribers, please turn on all your notifications.